Welcome to Make the Grade with the Success Doctor, Stephen Green, where you'll discover actionable strategies to help your student to reach their academic goals, to excel at standardized testing, and to plan for the college admissions process painlessly. And now, here's your host, Dr. Stephen Green.
All right, Dr. Stephen Green, the Success Doctor, coming at you with another Make the Grade podcast. And today is going to be a really good one. As you know, listenership people, I love to bring in experts out there in the field. And I got a really good one today. I think you're going to really have an interest in what he's going to talk about. So get your notebooks, get your listening gear in place. The always goal forever in this podcast is to try to give you, the parents, you, the students, some actions you can take to maximize your education. So my guest today is Marty Franklin. Marty, welcome.
Thank you.
And little history. Martin E. Franklin, PhD, a nationally renowned expert in the treatment of obsessive compulsive disorder, OCD spectrum disorders, and body-focused repetitive behaviors, as well as the study of treatment of anxiety and related conditions. Dr. Franklin is Associate Professor Emeritus of Clinical Psychology in Psychiatry at the University of Pennsylvania Perelman School of Medicine, and he's been honored for teaching excellence. Dr. Franklin also serves the Clinical Director of the Rogers Behavioral Health Philadelphia location, so quite a pedigree.
Yeah, well, when you've been out here a long time,
yeah,
get to go
everybody else, it's like me. Everybody else retired, so I finally got a good job. So let's start with this. You're a therapist, right? So
yep.
What's your typical age-wise or maybe socioeconomic? What's your sort of? Is there a typical family or a typical case that you serve before we get into some of the nitty-gritty?
Yeah, and I'm in two different places. I'm in an outpatient clinic 1 day a week, and then here full-time pretty much at Rogers. And I'd say those differ somewhat. At Rogers here, we're taking kids at a higher level of care. And I would say customarily those kids, probably 60% of them are local. We see 30 to 40% or so from outside the region. And we do intensive treatment. So it's basically for partial hospitalization, it's 6 hours a day for about 6 weeks. For intensive outpatient, we drop them down to 3 hours a day for usually 2 to 3 weeks. And in my other setting, I'm usually seeing people weekly. And I would say we run the full gamut age-wise. Here, I'd say, we could see kids as young as 7 or 8. And mainly, I think we're focused on treating older children and teens here at Rogers.
Okay.
And at the other setting I'm in, which we call Harbor, which used to be Cottage when we were all at Penn. At Harbor, it's a private practice, and I'd say we run actually 3-4 years old. We see some kids even that young, and then we run all the way out through adulthood as well. With focusing mainly on anxiety and related conditions. We all have expertise in obsessive compulsive disorder. Here at Rogers, we also treat depression. And that depression recovery program runs ages 12 to 17.
For the parents who may not, the whole spectrum of clinical disorders, where does OCD fall? Is that diagnosed? Or maybe that's not the right word. In sort of a categorization, you have sort of the attention issues, right? Like the ADHD sort of thing. Where does this fall in kind of the whole piece?
OCD, until the DSM-5 came out, was categorized as an anxiety disorder.
Okay, subset, yeah.
In DSM-5, it actually got its own separate standing. So OCD and related conditions. And so OCD, and what's interesting about OCD is you can certainly see pieces of it, some kind of subclinical symptoms in folks who don't have a full diagnosis. But to get a diagnosis of OCD means that your symptoms are causing functional impairment, enough to matter, enough to be in the way, as opposed to occasional worries or occasional repetitive behavior. We don't pay a lot of attention to that. And I
Mm-hmm.
don't customarily see people who are mild. I'm seeing people who are already impaired, sometimes very impaired. But some of the things that we might see in worries about testing, we also, I would expect to see some of that in most kids. Most kids
Mm-hmm.
are going to be anxious about tests at least a little bit. And then the question is who's more anxious? And then the point where who's so anxious they can't take the tests. And
Right.
those kids wind up getting a diagnosis often, not always OCD, but sometimes a generalized anxiety disorder, and those kinds of things then require some more formal interventions than you might try with a kid who's milder and is just worried about one particular test.
So I'm coming from the mindset of a parent who might have a child and this is a story I hear a lot. So my kid studies, they go to a tutor maybe, or I quiz them. We feel like we got a handle on the situation. They go into the test, they don't do well, they freeze. Uh, these are not clinical terms. They get stuck.
Yeah.
Do they have test anxiety? So now let's talk about this. So what are the causative factors? Is it just school? Is the pressure of getting into the right college?
Yeah.
Is it parents putting pressure on kids? Is it peer to peer? Where do you think about this? What would you say is a of the laundry list of causes? Where do
Right.
you
And,
sort them?
and I think it's important to distinguish
Or
between
I'm sorry, or is it organic, or is it a combination?
probably all of it. And so
Okay.
my sense first is it's important for me to know if a kid doesn't do well on a test, is it because they don't understand the material? And so for the kid who's studying and doing fine, doing well on practice tests, and then bombs the actual test, that makes me wonder if the freezing is anxiety driven, or is the freezing simply a function of having run into material I didn't study? So I want to differentiate those things first. Once
Mm-hmm.
I identify that I've got a kid who knows the material, who doesn't have any undiagnosed or diagnosed learning problems that will interfere with performance, so it really looks like the anxiety is the thing driving the problems. I want to be pretty careful in those circumstances to start asking important questions about what is it that happened. So when you're talking about freezing, I want to know more specifically what it is the kid experienced, what it is that the kid started to get stuck on. And I want to see if I can understand that from the perspective of is this a knowledge issue or is this an anxiety issue? So once I can kind of
Mm-hmm.
pass through that, for the kids who are super concerned about their test performances, in terms of which kids are vulnerable, the first thing I would say is if you have anxiety in your family, I mean, we could talk about this as genetic or we could talk about it as learning. It's probably a mix.
Mm-hmm.
If you have anxiety in your family, you might be more likely to experience that sort of pressure about testing. It's not a guarantee. It's not like eye color, but you're more vulnerable than the kid who doesn't have anybody in that family who worries about this. I also think that we are, especially in higher SES groups, we're becoming more and more concerned about which college they go to. We're becoming more and more concerned about your GPA and your class rank and all sorts of things, this sort of competitive stuff that leads, I think, sometimes people are worried that if you don't have a certain profile, you have no chance of getting into the elite schools. And for some reason, we decided that the elite schools are the only places worth going as a society, and certainly parents contribute. And I
Mm-hmm.
think parents and school and society, they all contribute to that. And so if I've got a kid who's already vulnerable, and I have a school system that's saying that basically, if you don't go to an Ivy League school, we don't want to look at you. And you got parents who have the same vulnerabilities.
Yeah, you
I think you
created
put
a
all those
soup,
things
right?
together in that soup, and I may have a kid who and a lot of times anxiety comes down to this. That the first thing is, and social anxiety especially, which could overlap with test anxiety. First thing that folks with social anxiety will tell you is it's terribly important for me to do well. And the second thing they'll tell you is that I don't think I can. So if you think it's important to do well and you don't think you can, you're in a pretty vulnerable spot for being anxious.
Hmm.
If you apply that to social situations, you can see where someone would be
Is
socially.
Is it, I mean, I could see an adult probably having some level of coping mechanism for this, but I think this would be scary in a 10, 12-year old,
Oh, for sure.
and probably as a teenager. Um, so I think to sum up what you said, there's a nature and a nurture piece to this, right?
Both.
There's
Yep.
an organic side and maybe a little bit of a disposition based on your family
Right.
history or your family environment. If you got
Yep. Both.
super
Yep.
type A expectations, their environment is going to play a role too. Society is playing a role.
No question.
How about how much pressure the kids they put on themselves? Some
Yeah.
kids don't. Some kids are like, whatever. Some kids are just super driven.
Right. And some kids, it's interesting to see because you do occasionally run into a kid whose parents seem to be pretty relaxed about it, and is the kid putting pressure on themselves. And those kids, I'm very interested in what they think is going to happen if they don't do well. I start to drill down a little bit on what their thinking is. And sometimes they have unrealistic expectations of what it's going to take to get into a decent school. And sometimes they have unrealistic expectations for if I don't get into these particular schools, my life is going to be negatively affected. And we have to challenge some of that as a society. We have to challenge that as parents. I think there's nothing wrong with ambition.
No.
At the same time, if ambition is driving your kid to have stomach aches before every exam, I have to start asking if my messaging is the best match for my kid's style, temperament.
Well, I would think it's not. I mean, we're focusing a little bit, at least right now, on test anxiety because that's a common
Yeah.
complaint in the academic side, in the tutoring side, and from a treatment side, it's identifiable, right?
Yep.
I mean, from the OCD piece, I see some kids come over to my office, and their homework is just absolutely pristine. I mean, if they make an O and it isn't like a completely perfect circle,
Yeah.
they erase it and do it again. And I think that's kind of a manifestation of the same thing. I see kids because of the compulsiveness spending 45 minutes doing homework that might otherwise take them 15
Yeah.
because they're so concerned about the penmanship or it being, exactly the margins on the side of the paper.
Yep.
And I know that this is one of these things where you can't separate one single thing out, right? It's always
Right.
tied to the web of causative and things like that.
Sure.
I'm a parent. I see a kid. I'm like, I'm happy my kid's driven. I'm happy my kid's motivated. I'm happy my kid's not getting in trouble with a bunch of bad kids.
Yeah.
But where's the line get crossed? Where does a parent say, you know what, this is too much. This is harmful, or this is unhealthy. Maybe that's a better word choice.
And I think it often comes down to how well your kid functions. And I try to get parents to pay some attention to how broad the kid's life is. Because your kid is spending all day Saturday, all day Sunday, every week, doing nothing but academics, not going out, not seeing friends, not being involved in sports, not
Or
being
a lack of balance.
Right, that this is exclusively their job. I start to wonder if the messages about how they have to do, if those messages are getting distorted. But I want my kids to be balanced. I don't want my kids to be so, perfect in one spot and not in another. And so I'm paying a lot of attention to what they're doing outside of school. I'm paying attention to exactly what you said. If a worksheet took you 45 minutes, it should have taken 10. I'm interested in why. And for some kids, it's exactly what you said. It's the physical depiction, the letters being perfect. For other kids, it's more like, what's the teacher going to think if I don't put in full effort? So those questions have different answers, and I think they can lead you to make. I'll give you an example. So if I'm treating perfectionism OCD, and I've got a kid who's all about the perfect, writing out perfectly, my practices, my exposures with this kid are going to involve making small mistakes on their paper and turning it in anyway. And I may start with just doing it in my office and having them hand it to me, and we put it in a shredder. Just getting them used to the idea they can tolerate, they can survive having done something that was imperfect. Then I start to move it up to handing it in imperfectly, and sometimes it's handing it in imperfectly as in how it looks. But for some kids, that's not the issue. The issue is how it sounds. Like is it correct? Is it thorough enough? And for some of those kids, I might have them giving in essays where they said to write 6, at least 6 sentences. I want them to write 5, and practice doing it wrong. Because the reality is, if I hand in a homework sheet and it's not exactly perfect and I get downgraded on homework, the reality is, just looking at what percent any individual homework assignment is going to contribute to your overall grade, it's pretty minimal. So I want you to learn how to take risks. I want you to learn how to do things faster.
Or safe risks.
Precisely.
Right.
And I think these are certainly under the broad umbrella of safe risks. And if someone tells me that doing imperfectly on an exam is not a safe risk, especially if that person is a parent, then we need to have that conversation.
Right.
So we're not going to overcome that if we don't have everybody on the same page.
So there are sort of internal expectations, what the person is driving. Then there's external ones that they may or may not put weight onto. What it reminds me of when I was my graduate work's in educational psychology, which is a little lighter weight than what you're doing. But I remember the classic thing: somebody's afraid of snakes, right?
Yeah.
So you don't bring a boa constrictor in the room.
No.
You show them a picture of a little tiny baby snake, and you let them hold the first. You put the picture in front of, then you let them hold it. And there's a series of things that sort of build up a tolerance in a sense.
Right. That's exactly right.
I mean, there's, it's interesting because I was, there's this like so-called happiness quotient, right? I don't know how plugged in you are to that side of the psychology, sort of humanist piece that if that even exists. Kind of out there still, psychology kind of things come in.
Penn has done a lot of work on these sorts of things, on resilience.
So, I mean, you could beg the question: if a kid is happy having what maybe a clinician would consider aberrant behavior or abnormal or outside of the, the box and whisker chart, isn't that okay? But I think what you said that's the exact counter argument is if it's getting in the way of the rest of their life. Right.
So a kid who says that this is what I want to do with my 7 hours after school, and they might feel perfectly happy with that, and they're getting good grades. The system is reinforcing them for it. Their question might be, what's the problem?
That's what I'm saying. Right.
I'm not spraying graffiti on subway platforms. Like, why are you on me about this? And the answer would be because this is not sustainable. You can't, in the long run, continue with this level of effort because as you go up in education, you're going to have more demands, you're going to have harder work, you're going to have other things you need to do. And if it takes you like 6 hours to do something that should take 2, that's 4 hours now that's taken away from things you're going to be asked to do later. And so what you do in 6th grade with your worksheets may or may not be, you might not feel it as an issue. But when you get to 12th grade and you have 8 classes and you have worksheets in all of them, you do the math. You don't have 56 hours to do all that.
From a clinical treatment standpoint, is it easier to treat, you don't use the word cure, but is it easier to treat this in, let's say, a 10-year-old and a 15-year-old and a 20-year-old because the habits are that much more ingrained?
Yeah.
So you want to catch it as early as you can.
I think there is some evidence that catching it earlier does make it easier, and those treatment gains are usually more durable. Well, sometimes what it might be is if you catch it early enough, you don't see the development of secondary anxiety disorders or comorbid depression. So the earlier I catch it, maybe I'm changing the trajectory for that kid. So, and teaching them some strategies, and my strategy, and we talk about coping strategies all the time. The most important coping strategy for anxiety is leaning into it instead of away. Avoidance is the biggest problem. And so if you have somebody who gets worried about an exam and they're so overwhelmed they don't study for it, now they start to cram.
And it becomes a self-fulfilling prophecy.
Yeah, and indeed, you're going to wind up having a sense that you don't master the information, and then the test might come out and prove that. What's interesting is those kids will then double down on the same strategy, and that the strategy wasn't working before. We need to change it up.
So as a clinician, you obviously have a trained eye, right? As a parent, a lay person, for lack of a better term, right?
Yeah.
What would a parent, what would be a something a parent could look for, or maybe even a parent could ask a
Yep.
teacher to look for, that might say, hey, listen, maybe we need to take this to another level, or we need to seek professional
Right.
counsel, even on an entry level. You know,
Right.
you don't have to
And
go.
I would say a few things. I'd say the degree of distress.
Okay,
So
degree
some
of
kids might
distress.
be worried about the spelling test. The other kid is throwing up days beforehand. So the level of distress might be part of it.
Okay.
Another piece of it would be avoidance. So if I have a kid who now won't go to school because they have an exam, or they leave in the middle of the exam, or they move heaven and earth to make sure they don't have to take it, that also gets my attention, because lots of people could be nervous on exam day, but I'm looking at the subset of kids who are so overwhelmed that they, and as you said before, either bomb the test or wind up zoning out or just wind up not even going. So those kinds of things I'm looking for. I'm also, with teachers in particular, I'm very interested in the kid who comes up at the end of the class and asks you the same question multiple times. So the homework it's page 48 to 49, right? Yes, that's what it says on the sheet. So it's 48 to 49, yes? And there's a subset of kids who have ADD where I may actually want to reinforce some of this effort, because that may be their attentional issues might lead them to need to be more organized and more thorough about this. But the anxious kid who's already got it written down in a homework planner and walks up to you and reads you I understand this is due on Friday. Am I right? Yes. So it's due on Friday? Yes. If I get a bunch of those questions in a row, it leads me to think the kid is doing some reassurance seeking, and then I'm going to look in general at, is this a kid who's always stressed out about school? Is a person who looks terribly unhappy? Bathroom breaks or excuses to leave the room during my test. And I'm looking for those, not just one thing, but a constellation of things that lead me to think that the kid's taking this really seriously. And sometimes the kid will tell you, and sometimes the kid won't tell you, but their behavior will tell you.
Especially as they get older.
Looking for.
Hey, by the way, Steve Green, Make the Great Podcast. I'm talking to Dr. Marty Franklin, psychologist, expert in obsessive compulsive disorder. There's my attention issue. Let me ask you this, because I have had this experience in the last 3 months in my caseload. A parent had a child who they felt had a compulsive issue, but they were reluctant to even go to therapists because they were afraid to open the door. They didn't want to go down the whole. They didn't want to open it a little and find out, it was a lot going on, and it was going to be a protracted treatment, and maybe it was. I think they just didn't want to know anything was actually wrong,
right?
Or they were afraid that it was sort of the tip of the iceberg of a clinical. Your view on that, and I encouraged them. I said, listen, it's not your life. This is your child's life. You got to serve their purpose as number one. But your reaction to that, is it something?
There are a variety of reasons parents might be reluctant. I'd probably want to explore why in particular this family was reluctant. For some people, it's like you said, they're almost afraid of opening up a bigger can of worms.
Well, that's exactly what the parent said to me.
And my reaction to that is, well, that can of worms is going to open itself later. So my sense is that we want to catch it now before it's spread out, before it's it's more of a broader issue. So early intervention is really important. So even if a kid's got relatively mild symptoms, I'd rather catch it and teach the kid how to address it rather than leave it be and have a kid come back. Because you see this a lot in OCD around academics, which is the kid is the best student of the class, 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 not in the class. And because they reach this point where they recognize it's not sustainable, and their methods of avoidant coping aren't working anymore. Or if they have active compulsions, the checking is not working anymore. And I think if I catch it when they're in 5th grade, I feel like I have a better chance to sort it out than if I catch it when they're 24.
So the message to the parents is this should be investigated.
Yeah. Yeah.
Absolutely
and
right.
There's probably not much harm in looking at it and seeing that the kid's just having a tough stretch or doesn't get geometry, in which case we can address that via educational intervention.
Right. Yes.
As opposed to, this isn't about geometry, this is about the threat of being evaluated and the threat of not doing well. And that your kid is taking that and running with it and doesn't have a way to slow that down.
Here's maybe a tough one for you. Sometimes I'll see situations, and to be really blunt, where the kid just doesn't have the chops.
Right.
I mean, not everybody's going to be a straight A student, despite all the support, whatever. But the parents' expectation is you're going to, your mother and I did this, and we were straight A students, and that's definitely fallen into the family environment. But at what point is it just a reality that the expectation, if whether it's the child's expectation or the parent's expectation or some external expectation, the child just cannot fulfill it. They just don't have the intellect, maybe, or the drive, or both. Yeah. And I see this not just in academics. I see this with kids who are like, really in these high level travel sports programs.
Oh yeah.
Where their whole goal is basically to excel enough to get college support, scholarships, and so on. So this is not limited to academics, but I think it's a similar phenomenon. But it's a tough conversation to have with a parent.
Yes, it is.
It's like when I was teaching, one of my roles was I had to do evaluations to see what we get accepted into gifted programs. Well, at least once a year, there was somebody that just didn't have it. I mean, there's really no kinder way to say it, right?
Yep.
And your kid's bright and your kid's smart, but the way gifted is defined, at least in the school district I was in, they weren't over the line.
Right.
What do you mean my kid's not gifted? You're telling me my kid's not gifted? Who are you to tell me my kid's not gifted? I mean, they're ready to punch you.
Yeah.
I'm
happy to absorb those blows in the spirit of not reinforcing this idea that you're either gifted or you're nothing. Also finding out what the kid is good at, what the kid likes to do. Mm-hmm. And it's what you said before, which is whose life is this anyway? That was a play back in the 70s, Richard Dreyfuss. And I think that it was it's well thought through. Like what am I doing this for? And if I'm dragging my kid to yet another tournament to get him a look at some, going to Colorado for a softball tournament, and I live in Pennsylvania. Mm-hmm. And and the kid is reluctant to go, doesn't want to go. It's like I have to ask myself, who is this for? And those are difficult questions for parents, because most parents are going to say, "Oh, I'm doing this for my kid."
Yeah, but somehow on a level, right?
A kid who's saying, "But I don't really want to do this."
Mm-hmm.
And I think I've got to get parents to recognize, and this is where some of that fear comes from, is that just because your kid doesn't go to Stanford doesn't mean they're going to be living in a refrigerator box in Center City. There are other people who don't go to Stanford and places like it.
I'm perfectly happy.
To work out just fine. And I'm willing to say that to parents, and as a large part to advocate for the kid. And there are other kids who say it's my dream in life to go to one of these schools, and the reason it is because I see this program as a good match to what I want to do professionally. Godspeed, kid. Recognize that you're going to add some stress because of that, and you're going to need to find ways to manage that and ways to make sure that you're not trying to get a 4.2 and a 4.0 system. Mm-hmm. And almost like you got to give them some awareness of what this path is going to look like. But if it's driven by the kid, I'm more inclined to think let's find a way to support this kid in doing this. Unless it's 7 hours of homework for what should take 90 minutes.
Which is a very sane sort of holistic way to look at this.
Yeah.
Let's let's do this. Just simple. This is not intended to replace therapy. But what are some things a parent could do or parents could do to help support kids? Maybe these are tools you're teaching kids in a therapy, outpatient kind of environment, especially if it's a mild, maybe a subclinical kind of level.
Right.
Is there stuff, kind of, sort of home remedies, so to speak, that we can throw out?
I would say there, certainly your own messaging will be important. I also try and I'm a parent too. I tried as much as I could to point out my own foibles and mistakes when I was their age, my own foibles and mistakes now.
That didn't work with me and my kids.
And so I don't put myself forth as being perfect. I wouldn't work anyway. But I also try to intentionally, I'll bring up stories that are funny of me misunderstanding a word or misspelling a word, to basically model this idea that I'm not perfect and I don't expect you to be either. Then your response to when they do well but not perfectly is a very important. So a kid comes back with an 89 on a tough test. Like, my question then is, what did you say? Both verbally and non-verbally. And my first question, I jokingly refer to a lot of parents in our region as having bee phobias, and I don't mean the bug.
You mean the grade?
A is a good grade. A B is a good grade. Okay, so I try to recalibrate that, and as a parent, that's what I want to make sure that I don't give the disappointed look. I guess you're not going to amount to anything when they come in with an 84. And if they come in with an 84 and they say this is the hardest test we ever took, and the class average was a 69, I have a different reaction. But if they come in with an 84 and it's clear they were mailing it in, I have to ask myself, is there a way that you think does it matter to you that you got an 84? And if a kid's like, well, yeah, it's kind of disappointing, and then fair enough. Instead of admonishing the kid, I'm like, I wonder what you could do to make that a little bit better. Like, what could you do?
So the advice here, at least one thing, is just to be reasonable. Right. And realistic, right? As a parent, as a mentor. Right.
Exactly. Yeah, or to use humor. My father, who's an Irish immigrant, 8th grade education, comes here to raise his family because he thought we had more opportunities. And my mother was sort of a driven person who was more on the academic side. And I remember one day I bring home a test, and my mother wasn't around. So my dad was home, and I need him to sign the test. This is 8th grade or so. He picks up the test, he looks at it, and I got a 97. And he looks at the test through his very thick lenses, and in his Irish brogue, he says, "What happened to the other 3 points?" My response was, I know where he's going. My response was, I got those questions wrong on purpose, simply to torture you. And he smiles, he goes, "That's me boy," and he signs the test. So there's a humor about it. So he recognized I didn't get 100. He also I think he was recognizing that a 97 is a pretty darn good grade. And so there was that sort of rapport about, like, do as well as you can, and at the same time, no one's gonna rake you over the coals about getting a 97 or even an 87. And we were good students, but we weren't subjected to that sort of, oh my God, you're never going to get into Harvard. Like, my parents were immigrants. I don't even know if they knew what Harvard was, which actually put us in a different position, in that we had to figure that out. And then much of the academic drive was coming from us, not from them. They just wanted us to do well and be good people and get jobs and not live in their basements, which all worked out beautifully.
I'm a 15-year-old kid. I want to try to self-monitor this. I want my parents on my back. Yeah. I don't want some. It's like Good Will Hunting, right? I don't want some therapist telling me what to do. Good Will Hunting. That's the movie, right? Yeah.
Yes, it is. Fabulous movie.
Is there something that, speaking to that population that might be listening, you can, maybe throw out a nugget or two to them?
Yeah, and I mean,
it's probably in the same theme, right? Which is just be realistic, right.
But and what I tell people all the time, at 15, even younger, but certainly, my adult colleagues, is, what's your goal?
Mm-hmm.
and work backwards from your goal. If your goal is to go to an Ivy League institution and you feel like that's crucial, then that sets a certain path. If your goal is to get into a college and pursue an education in some particular area, then work backwards. What are the things that will help me get into a program that's about marine biology as opposed to physics? So I want to kind of get you to start thinking about how those things work, and grades are a part of that presentation.
Mm-hmm.
Like if I'm applying to a program that's, like they say, you can't even apply to this program unless you have a 3.6. Fair enough. I need to work towards a 3.6, and I want people to set their academic goals, and I also want them to start working backwards from those goals, but I also want them to pay attention to balance and sustainability. Because if I have to study 16 hours a day for 6 months, that's not sustainable. I'm not going to be able to do that, and nor should anyone expect me to.
The sustainability concept, I think, is really wise.
Yeah, you're going to burn out otherwise.
Yeah, I mean, long term for sure.
Yeah.
Short term probably also. One last thing here, and then I'm going to kind of give you the final word. I see a lot of kids that need 25 hours, 26 hours in a day. They're going to school. They're on a sport. They're in a play. They're in clubs. They're in out of school activities. They're volunteering. They're have jobs. They're taking driver's license tests, whatever.
Yeah.
That by itself creates pressure. I don't want to use the word anxiety.
Right.
It's a juggling act, right? Everybody says, "Oh, these kids are 20 times more busy than I was when I was growing up." I don't know if that's true or not, but is there any does that environment drive the anxieties and these things as much as anything else? I mean, I know I'm kind of circling back to that because I'd taken some notes when we were talking, but I just wanted to ask you, because we kind of identified internal sort of pressures might lead to this, external ones. And the third one that occurred to me was just this idea of just sheer volume of responsibility, right?
Yeah.
And a lot of times it bring it on themselves. You know, they want to be in a lot of things, maybe for the same reasons. They want to pad their academic resume, or they just want to be involved. But in your experience, is that a third of the problem? It's dependent on the kid? Is it whatever?
Probably depends on the kid. Probably depends on the setting. But what I try to get kids to do is look at their schedules, and the first thing I ask them is where's your hour to waste? Where's your hour to listen to music? I listen to music as a kid a lot, maybe more than I should have. But where's the hour? Like where can you find some place where you can just turn it off?
Downtime.
If I'm looking at your schedule and I don't see any downtime, I'm going to try to figure out where to find it. And sometimes they can find it in their academic schedules. So if I've got trying to work productively, if I have 2 study halls during the school day, I want to use some of that time to talk to friends, and I want to use some of that time to knock out work that I can, so that I'm not up at 11 o'clock at night, 11:30 at night, still finishing stuff. I also then ask them, okay, so if you're in 11 clubs, like let's just think about this from the perspective of the person who's reviewing your college app. If you're in 11 clubs, does that really mean that you're in 11 clubs, or does it mean you're trying to pad your resume? Like, do things you're passionate about, do things that define you, do things that are interesting to you, because you'll be more of an interesting candidate if you're in 3 things than if you're in 11. And I'm trying to find you that hour to just listen to somebody's dropped album today. And I'd rather you do that than fill it up with needless
just another activity for the sake of an activity.
Right. Because I don't, in the end, I'm not sure that impresses people as much as the kids think that it might.
No, I mean, I can tell you in the amount of college counseling I do, all the admissions people I know would rather see leadership roles in less things than participation in many things.
Right. Right. And I'd like to get kids to just really pay some attention to making sure they're restoring themselves. Like sleep is another issue. I mean, some of these kids are up at 3 in the morning, and then they're getting up at 6 to get ready. Like that, the 5, and then they will sleep for 15 hours on the weekend. That all the sleep hygienists will tell you that's not a fabulous idea.
No, it isn't. That's a completely
I
additional.
know that's another podcast, isn't it?
As a couple podcasts, there's a big push in a lot of school districts to open later, and then the argument
I
is we're just
love,
going to.
I love that.
I have mixed feelings, but I favor it more than I don't. But um, Marty Franklin, thank you. I want to give you anything we didn't cover. You want to talk? Anything you want to plug? You have any
Well,
specialization in your practice you want
sure.
to
I
share
mean,
with everyone?
did have a book come out last year,
Okay.
published by Guilford Press. It's Franklin, Freeman, and March, and the title is Treating OCD in Children and Adolescents, a Cognitive Behavioral Approach. And within that book, the reason I think it's of some relevance is we do see a fair amount of perfectionism in the context of obsessive compulsive disorder. And so the book has examples and even dialogue of how you would interact with a family and interact with a kid around making these mistakes, moving faster, kind of consolidating their work so that they're not overwhelmed. So I think that might be of some relevance. We
Can
do
you
have
give the
this
title
practice.
again? Give the
Oh
title
yeah,
again. Treating
treating OCD in children and adolescents, a cognitive behavioral approach. Guilford Press. Came out in 2019.
I will put that in the show notes for those of you who are interested. So you are a best-selling author.
Well, we're out there. I did a number of book signings, which was fun around the country.
Well, I have a book. This is my book. I just had it here, but
Oh, excellent.
yeah. But this was a bestseller in the education category, which for like 11 weeks in a row. What they don't tell you is there's only 4 other books
Oh,
in
yeah.
the category.
I don't even ask those questions.
Yeah, right. If you're double-digit sales, you're doing pretty well in education.
I'm just trying to give therapists a resource to use if they decide they want to try some of this cognitive behavioral stuff if they're not expert at it themselves.
If let me ask you this, really more as a parent. Yeah, I really am impressed with your what I'm going to call holistic approach. Maybe you wouldn't call it that, but I think you're looking at the whole kid, the whole child.
Right, yeah.
I've got a strong sense that you're putting the child first, which I applaud, and I believe I do the same thing in my academic side of things. Is that not everybody's going to be able to come to see you, right? Especially if they're listening to this in California or Texas or
Right.
where a lot of places. Is your approach? Would you say this is consistent among therapists that treat what you do? Is there a broad kind of differentiation of different approaches?
I would say cognitive behavioral therapists with expertise in anxiety would probably be saying very much what I'm saying.
Okay.
And we're very much present centered. I don't care what you're doing 7 years ago. I care about what's happening now. I'm very interested in avoidant behavior. I'm very interested in repetitive behavior because those things may be digging the hole deeper that you're trying to get out of. And I'm very interested in family environment and school environment and what contributions they make. And also, can we modify those contributions like we were saying before, having a different way of expressing that you're proud of your kid, and at the same time, if you think your kid's not putting in a maximum effort, to talk about that in a way that's convergent with the kid's own goals, as opposed to you're ruining our family and now you'll never get into Dartmouth. But it was funny is because most kids who are not anxious would dismiss that out of hand and say that's a ridiculous thing to be saying.
But
the anxious kids are more vulnerable to that message.
Right. They're sort of on the edge of the cliff, so to speak.
Right. And anything like that is another push in the wrong direction.
Mm-hmm.
So if I know my kid's temperament well enough to realize that they get dialed up quickly about these sorts of things, and I want to be dialing it down. Another thing, this is from a book that I read maybe 15 years ago. Gary Nessner, who interestingly enough was one of the FBI's chief hostage negotiators. He wrote a book about maybe 20 years ago called Stalling for Time. And basically it was about how to negotiate with people who've taken hostages. And he's been at many of the famous scenes in the last 30 years. And what Nessner's book, 250 pages or so, what it essentially says is this: when people are escalating, you should probably consider de-escalating. So if my kid comes in and they're upset about a test, the last thing in the world I want to do is join them in that. Either fight with them about it or say, "Oh my God, it is unfair." This
You
is
want
so
to diffuse.
right. I want to step it down.
Mm-hmm.
So I want to say, well, let's think about this a minute. There's another book, which is I'm throwing books out here. Anne Lamott. So Anne Lamott is a writer, and she wrote a book on writing, and the name of the book was Bird by Bird. And so, and the introductory part of Bird by Bird is Anne Lamott is a 10-year-old who gets an assignment in school that she has to do a paragraph about the various birds they've been studying in their school. And Anne Lamott is an anxious person. She comes home, she's 10, and she's crying her eyes out. And her dad, who seemed like a pretty low-key guy, who's probably good at what we're talking about, she comes in, she's bawling her eyes out, and he says, her nickname for him was Pumpkin. He goes, "What's going on, Pumpkin? What's wrong?" And she starts spewing that she has to do I have to do an entire paragraph on the 30 birds. I don't know how we're going to start. I don't know how we're going to get through it. And the dad just sat her down. I said, "I know exactly how we're going to do it."
Well, we're at a time.
He says, he waits. He says, "We're going to do it bird by bird," which he helps her break the task down, and he doesn't get sucked into the idea this is too much for her to do.
Right,
and he works with her. And next thing you know, I've got a task. Instead of thinking about, "Oh my God, I have to write about 30 birds," I write about the blue jay.
Then you move on to the cardinal, and then
Then I got the robin. Now I got the oriole. And next thing you know, I'm halfway through it, and I don't feel overwhelmed anymore because I was able to break it down. So his role as a parent was to dial her down, and he did it beautifully.
It's so there's so much. It's like just basic human psychology in this stuff, you know. When you were saying the thing, first of all, the fact that the guy could write 200 pages about negotiations kind of amazes me to begin with. But
it's interesting stories.
It reminds me almost like the DISC analysis, if you know what that is. It's taught a lot. It's a little dated now, but it's taught a lot in sales.
Mm-hmm.
You got like an intellectual person, you will talk to them intellectually. You got an emotional person, you talk to them emotionally.
Yeah. Matching, right.
All right. So you got a book. This is excellent. This is, just really interesting stuff. I'm going to wrap this up and just, is there anything else you want to talk about or just closing?
Yeah. I think the first pass is always going to be the parent and the teacher together, maybe the school counselor trying to help a kid who looks like they're having trouble. If I see that the problems are persisting or worsening, I may want to reach out, find myself a cognitive behavioral therapist. Anxiety Disorder Association of America, the International OC Foundation will help that happen. They have listings of trained therapists. And then if I get myself to a therapist that I start doing weekly, and that's not enough, because the kid's functionally impaired, stops going to school, then we do have some options for higher level of care, which is at Rogers, what we're doing locally. But Rogers, we have 12 sites around the country. So we now have in a position where we can help people do more intensive treatments if they need them. And the people who need them are the ones who didn't respond to the lower level of care and the ones who are getting functionally impaired still or getting worse because an hour a week is not enough for some kids.
It reminds, I'm not positioning myself as a comedian, but it reminds me of a joke. You could apply this to they apply it to tutoring too sometimes, but a person goes to a therapist or a tutor, you fill in the blank, and they're laying on the couch and they're getting treatment, and the guy says, "Doctor, I got to ask you, when am I going to get better? I've been coming to you for 10 years and we talk and this and this, and I don't know if I'm getting any better or not." And the doctor, the tutor, whatever you want to say, says, "Oh, that's easy. You'll get better when you can't afford to pay me anymore."
A little dark. And what I would say there is that cognitive behavior therapy it's usually thought of as relatively
what the message I get from that is there's really two things. A person has to want to improve.
Sure. Oh,
right?
yeah.
You could give somebody 100 tools if they don't use them.
Yeah.
And I think when you get a good clinician with the right tools and can put them in place in the right way, I've seen kids I've seen in some of these therapies make really fast progress, and it sticks. More importantly, it sticks.
Right. about durability. Yep.
That's really the key. So, all right, listen, Steve Green here, Dr. Stephen Green with Dr. Marty Franklin. We got a PhD convention here.
Well, thank you so much for having me on.
Marty is local to me in the Philadelphia area, but I will put all his information in the show notes if he's willing to accept emails or something if you have any questions. The podcast here is always about trying to give you parents and students actions you can take to help further your education. And what we talked about today, I think, is really a really interesting subtext. It's a broad issue on a lot of levels of severity, and hopefully this was valuable for everyone. So, Marty, thanks again.
Sure.
And thank you, everyone. If you have any questions or comments, please drop them below in the comment area, and we will see you next time. So long.
You've been listening to Make the Grade with the Success Doctor, Stephen Green. If you enjoyed this episode, be sure to subscribe. For more resources and support, please visit makethegrade.net.